Hi, everyone. Good afternoon. I just want to take a moment to say a special thanks out to our entire team, my team at the Ohio Department of Health. They've been working tirelessly since probably early in January on this response, and I couldn't be more proud of them. A special shout out to my communications team out at the Emergency Operating Center. I appreciate all that you're doing. What I just saw and the governor's team put together out in this amazing commercial that's going out, it just really warms my heart, and I know it does yours. So you're just doing an outstanding job. And you know, the governor has really created an incredible team of people to help us through this response. So it's, of course, an honor to work for him and our lieutenant governor. And I just want to share with you, I feel like my role coming through this is keeping you understanding the science behind this and sharing the numbers as we have them. So let me share that we do have 564 confirmed cases. Again, my caveat, this is the tip of the iceberg. This is still behind, a little bit lagging in time from getting test results, as well as our still ramping up testing capability. But we do know for certain that we have at least 564 cases in Ohio, and now those are in 49 counties. We have age range of less than 1 year of age to 95 years of age, and I'm very sad to say that we now have 8 deaths in Ohio. We have some new statistics I'll share. 145 hospitalizations of those cases, 62 in the ICU, 25 of which are from long-term care facilities. As we've seen in other states, nursing homes, long-term care, particularly hard hit. And again, I just think we have an amazing team supporting those out on the front lines, but it really is those folks helping the people we love that are doing just such an amazing, amazing job right now. I do believe we have some data to share with you. This is the beginning. Those of you who ever had me as a professor of global public health will know that I'm a big fan of Hans Rosling, great TED Talk, one of the greatest statisticians. And we have teams of experts, of scientists from multiple universities, and we're working around the world with other folks doing modeling, some really great tech people, Innovate Ohio, as was mentioned, folks from universities all over this country. But we're learning some basic things, so I'm going to start with basics today, and we'll fill this out in the days to come. But some of our graphs will be on our website, coronavirus.ohio.gov. But what you can see is sort of a cases by county representation. Obviously, this is very, I want everyone to understand that cases are impacted by, if we could go back on that slide for a second. This is still by where we had testing the most quickly. So it doesn't give maybe the fairest representation of what's happening, for instance, in Southeast Ohio. Some of that's lagging. But you can see that also our daily increase in cases that has been going on. Next slide. We're going to start following for you a little bit. You know, we are seeing some trends here. And first of all, confirmed cases in healthcare workers. Of course, everything we're all doing is to protect those on the front line. We do know of our cases, 16% have come from the healthcare sector. Our hospitalizations of our cases right now is about 25.7%. I've said all along that about 80% of us will be able to ride this out as an outpatient, but we're seeing a little bit higher number of hospitalizations of our cases. And I think we're going to see that trend around the country. And then, of course, 11% of our cases have needed the ICU. And the ICU, folks, is our focus through this. It's all about the capacity of our hospitals to treat the sickest. So those numbers we will follow in days to come. Next slide, please. This is since the day back in March 8th, I believe, when we recorded our very first case in Ohio. We've been watching our trending lines, and what this graph is saying is, you know, what we've been saying all along, you know, it's expected in countries around the world that we will be following more of what we've seen in Italy. That is certainly the case in Ohio, as in every other state. And we're also following, you can't see very well on this, I think, but New York. The latest science, Dr. Ezekiel Emanuel from the University of Pennsylvania did a great op-ed in the New York Times. But what we can really expect is that we're on a 7 to 14-day lag behind New York City. So the rest of us in the country can sort of see what's happening in the places where they had their peaks and their testing a little sooner. Again, we know we're very close by, but we're lagging in that testing ability due to supplies. Next slide. Again, guys, it's all about the curve. And so we're doing our very best to keep everything we're doing with our measures and our policy is helping minimize the impact on our hospital system. And we are definitely up the steep slope. But what's most important is to start talking, next slide, about our hospital capability. Next, please. Ohio's response is really around two major areas. One is decreasing the spread, and two, as the governor just said much better than I can, the increasing our capacity through our emergency operations. So the stay-at-home is still everything that you can do at home. It makes a tremendous difference, and I promise you, Ohio, when we look back at what you have done, you as citizens have done, it is going to have made all the difference for us. We're doing policies to relieve the healthcare system burdens, and that was our trying to get rid of elective surgeries, getting our equipment from out in the field in. We're doing amazing things, converting anesthesia machines to ventilators. We're doing all sorts of things to increase that system, but you should know we will be having to build additional beds, just like you're seeing in places like New York. And then finally, this conserving PPE. Next slide. Bed availability in Ohio hospitals. I'll have a lot more on this days to come, but a couple numbers that I want us to start out with. We are at about 60% capacity in our hospitals. After our elective surgery stopping, we're about 60%. Our ICU beds in total in Ohio are around, I believe that says 3,600. The bottom line that we're learning now is it's all about ICU bed capacity. What you're going to see, and we're doing a lot of what we are seeing being done in Maryland, we're trying to keep people that can be routinely cared for, even that needed hospitalized in lesser care settings, and turning our hospitals into basically expanded ICU capability. On average, we're needing our hospitals to increase that capacity by 50%, and our hospitals are hard at work doing that. And we will be looking at things, you'll hear more in the news in the days to come, about hotels and even dorm rooms being turned into hospital units. So that is something we're having to do in Ohio, much like you're seeing happening in New York right now. Fortunately, we have a few more days to get that up and running, and we're learning from what's being done around the world and in New York. And then finally, last slide. We did distribute almost all of the PPE we have received has been put out in the field. Remember, PPE is personal protective equipment. That's what the governor talked so eloquently about, the gloves, the shields. There is a limited supply, that is the truth, and we have deployed that based in the need around counties, and you can see that by this graph. If you go to the next slide, please. Is that the last slide? We also have on our website what that entailed, what actual amounts of PPE. I think we have to realize that when we deploy PPE, we're doing it in boxes and cases, not truckloads. But the good news is that we have some really amazing researchers working on ways to reuse PPE, both here at Battelle in Ohio and also at the University of Nebraska. They're looking at UV light. So there are new guidelines coming out every day, every hour of how we can extend the use of that PPE. But I want to say to you again at home, what you're doing by stopping the spread is absolutely taking the pressure off our healthcare system, saving it for those of us who need it, the unexpected emergencies that we routinely have, and most importantly, for the cases that we know to come. We know that at some point soon, in a worst case scenario, had we done nothing in Ohio, and we're doing everything the science has said to do in Ohio, but they're anticipating that there could be up to 6,000 new cases a day if we aren't all abiding by these things we're doing. And if you had 6,000 new cases a day, clearly that would quickly outpace our hospital capability. And that's why every move you're doing is making all the difference. So thank you. Thank you for following the governor's sage guidance. Honestly, I couldn't explain our situation better than he is explaining it today. So please continue to follow his guidance and his lead. Thank you.